Welcome to the first episode of The Rationale. Today's question is, why is dextrose solution not given in head injury or increased intracranial pressure? So in head injury, there is cerebral edema, and cerebral edema causes increased intracranial pressure. So in order for us to understand very well why dextrose is not given in increased intracranial pressure, let me explain fluid shifts within the body. The main fluid compartments of the body includes the intracellular fluid, which is the fluid within the cells of the body. And then we have the extracellular fluid, which comprises of the plasma fluid. So the plasma fluid is a fluid in the intravascular space. And then we have the interstitial fluid, which is the fluid around all the cells of the body, excluding the cells in the blood. The intracellular and the extracellular fluid compartments are actually separated, okay? So they are separated by a semi-permeable membrane through which water is transported in order to maintain the body's osmolarity. And the fluid shift between these two compartments is via a process called osmosis. Now let's explain osmosis. So osmosis is the movement of water molecules from an area of high water concentration to an area of low water concentration. Or you can also say that an area of low solute concentration to an area of high solute concentration through a semi-permeable membrane. Now let's explain two key terms that we'll need. Osmolarity. So osmolarity is a measure of solute concentration in a solution. And then tonicity is the ability of an extracellular fluid to cause water to move into or out of a cell by osmosis. So I have here the image of four people pulling on a rope. So the four people represent solutes in a solution, and their ability to pull water into or out of a cell is what we are calling tonicity. So the IV fluids you administer can be classified as either hypertonic, isotonic, or hypotonic solution. So a hypertonic solution is a solution that has a higher solute concentration compared to the intracellular solute concentration. So when you put a cell, for instance, a red blood cell in a hypertonic solution, what happens is that there will be movement of water from the cells into the solution, causing the cell to shrink as you see in this image. Now, an isotonic solution is one that has the same solute concentration as compared to the intracellular solute concentration. So with this, there is no net movement of water towards the solution or the cell, okay? So the cell, in this case, will remain unchanged because of this equilibrium. Now, a hypotonic solution has a lower solute concentration compared to the intracellular solute concentration. So what is going to happen is that there's going to be movement of water into the cell, causing the cell to swell. Okay, so with this knowledge, let's explain why dextrose is not given in increased intracranial pressure or head injury. So dextrose solution are usually isotonic or hypertonic when in the IV bag, okay, depending on the percentage of dextrose that we are using. So for instance, dextrose 5% is an isotonic solution in the bag, but when it gets into the body, it becomes a hypotonic solution. The reason is simple, okay? So when dextrose is administered into the IV space, what happens is that the dextrose is metabolized or used by the body. And what is left of the solution now is free water, making it a hypotonic solution. We've already established that a hypotonic solution causes water to move into the cell, causing it to swell. So in context, when you administer IV dextrose, what is going to happen is that the free water is going to move from the intravascular space into the brain cells, worsening the cerebral edema. Simply put, when you administer dextrose solution, the body is going to use the sugar part of the solution, leaving free water. This is going to decrease the serum osmolarity, relatively increasing the intracellular osmolarity. Now we know with osmosis that fluid is going to shift from the region of low solute concentration to the region of high solute concentration. So water now shifts from the intravascular space into the brain cells, causing swelling of the cells and worsening cerebral edema. Okay, so in administering IV fluids to a patient with head injury or increased intracranial pressure, note that dextrose containing solutions should not be one of your options. So that's basically it. Thank you for watching this video. See you in the next episode. Bye.